Hi, it's Dr. Kostelnik with Rooted Behavioral Education. I want to talk to you today about why I think it's necessary that a clinical psychologist is part of your treatment plan in your vestibular recovery. You might be saying, I don't have mental health concerns. I've never been diagnosed with an anxiety disorder or a depressive disorder, and that's okay. Hear me out. I'll start off by saying that the numbers are pretty staggering for those with vestibular disorders who do experience anxiety and depression. And we know that it's about 3 times higher than people who don't have vestibular disorders. So that's piece number one. So the likelihood that you do experience anxiety and or depression is relatively high. And if you don't, that's okay too. So let me explain that clinical psychologists are experts in human behavior. So what that means is we know behavioral techniques and theory, and are familiar with the literature, meaning we know what research shows has helped people in similar situations to you. So it's not just tackling the anxiety and the depression, it's also other behavioral things like optimizing sleep, how to utilize your social support network, how to help calm your nervous system, which we know the vestibular system is very highly intertwined with the sympathetic nervous system, which is the fight or flight. And anxiety is also very tied in with that, which is why we can get into kind of a dizzy, anxious, dizzy cycle. And then just stress management. You know, if maybe you don't experience anxiety or depression, but we all deal with stress in our lives, and many vestibular patients will say that stress makes their symptoms worse, me included. I'm a vestibular patient just like you. And so I really wanted to highlight why I think it's important for any patient with vestibular concerns to see a clinical psychologist. Again, I'm partial to clinical psychology because that's what I do, but really any mental health professional. So I hope that explains a little bit about why it might be helpful for you, and we'll see you next time.